I wish I knew more before having babies.
There's so much mum shaming and there's so much judgment around what kind of birth we want, whether it means doing core exercises. Yeah, within the first few weeks.
So not like sit-ups or like sit-ups.
We actually want to be doing crunches early.
Oh my gosh. Welcome back, guys, to Let's Be Real. Today I'm joined by Sarah, the amazing physio that every woman wished she found sooner. We're talking about the real stuff no one teaches us. Pelvic floor, postpartum recovery, leakage, confidence, and everything women are just told to just deal with. So let's be honest, let's keep it practical, and let's chat. Sarah, welcome.
Thank you. Thank you for having me.
I can't believe you have your little 5-week-old
I know.
baby with you.
I know. You might hear some squeaks through the microphone.
Oh my gosh. That makes me feel really clucky, but at the same time, then I know how chaotic it is.
Yeah.
Raising the kids. So I'm like so torn at the moment.
I know. I've had this same chat with so many women. Like you see a newborn and you just want 10 more, but then you realize the postpartum phase, it's just logistically the chaos.
How your body also like going through pregnancy and then
the adjustment.
Oh my goodness.
Yeah.
Yeah. So I'm one of those women that's really torn in between. So for listeners listening in, Sarah, can you tell me a little bit about you?
Yeah. So I studied physio on the Gold Coast, and then when you study physio, you want to be a sports physio. That's like what everyone studies physio to be. Wants to work with sport teams, but I had a placement on the Gold Coast at Pindara on the maternity and gynae wards.
Okay.
And I had 3 educators and I learned so much about pelvic health. So when you do your physio degree, depending on where you study, you don't get a lot of pelvic health education. You don't learn a lot there. You've got to go ahead and do other extracurricular courses. So did that placement, fell in love with pelvic health. And I was kind of like low-key annoyed because I was like, why am I just learning all these things? And why don't women know these things? So from there, I graduated, went straight into private practice and did 1,000,001 postgrad courses just to get as qualified and learn as much as I possibly could to treat these women for pelvic floor concerns, postnatal, everything in between. So did that and then started my own business 2020 and it was just me. And now we've grown to a team of 10.
Amazing.
And it's been a massive roller coaster, but we've had some, really incredible highlights over the past 5 years.
Yeah.
I wouldn't have
So this might sound like a silly question to you because you talk about pelvic flooring all day, every day. Yeah. But for someone who doesn't know what it is, can you explain?
Yeah.
Because a lot of women actually don't even know. Like you said,
you're so right.
They're not even educated on it.
Yep. So the pelvic floor, essentially, you have your core, which is like your core canister. So if you think about your abdominal cavity, you have your transverse abdominis around the exterior. So kind of like the surrounding part of a can.
Okay.
And then the very top, you have your diaphragm. The very bottom is your pelvic floor. And the back, we have a muscle called multifidus, which is a back muscle, which still makes that part of the core. Okay. So all those muscles, pelvic floor, diaphragm, TA, it all makes up the core. So your pelvic floor is part of your core. People forget that I think your core is your six-pack muscles, but it's actually the deepest layer of your core. And your six-pack muscles, they're the extra external muscles. So your pelvic floor really is the base of the floor of the pelvis, and it looks to control urine, wind, feces. So it contracts, relaxes to let those things go and then, holds them in as well so we're not incontinent or having prolapse as well. So there's so many functions. Whilst it maintains our continence, it promotes organ support. So it lifts our bladder and bowel and supports it that way from a lower part of the pelvic floor position. It aids in sexual function and then again, it helps support our entire core complex. So
okay. That was a good
in a nutshell.
Yeah, in a nutshell.
There's so many more things that it does.
Amazing. I wish I knew more before having babies because I was one of those women that just never really heard about pelvic flooring or, I feel like they should teach this in some type of your health, part of school or when you have a baby at the hospital or somewhere like your GP, family GP. It's not spoken about, which is really bizarre because it's such a big thing for women. So anyone, you don't even have to be pregnant, just any woman listening, is there any tips or tricks to having is the term healthy pelvic floor?
Just being aware of pelvic health, I guess. I think it's so important because education is key, and we we really don't get any education when we go through our schooling, and it's kind of up to our parents to educate the kids.
My parents did not educate me.
No, but they didn't even know, you know, like they didn't even know that what the pelvic floor was. So we can't really blame anyone. But I think the most important part is if you can see a women's health physio before you even try to look into preconception.
So you would recommend that?
100%.
Wow.
Yeah. And the reason for that is because often you'll get pregnant, you might get recommended to see a pelvic floor physio, and then you might address some residual weakness or some long-standing pain that you've had for a long time. But if you come into us when you're, I don't know, a year before you even conceive, or even just like 3 months before you're looking at trying to conceive, we can pick up these concerns and these weaknesses and these bad habits that you might have created over the past few years before you even fall pregnant. Because the reality is when you fall pregnant, it's so common to have incontinence or pelvic heaviness, or your risk of prolapse does increase and your risk of pelvic girdle pain increases, your risk of ab separation increases. So if we can address these things before you even fall pregnant, it can make the biggest difference. And we have that backed up by evidence too.
Yeah. Wow. That's incredible. Do you think like the main thing I hear online from women who have babies is they'll jump on the trampoline and they'll accidentally pee? It's very common, a leak. Is there something they can do while being pregnant that will help that? Or
during pregnancy, you mean?
Yeah, during pregnancy. Because I feel like that's a lot of women's fear when they think of having a baby is like, okay, down there is going to be completely different. Yeah. Am I going to be one of those women that leak and pee, and when they sneeze, they pee? Like we see it a lot online, right?
We do. And I think the sad reality is it can be quite normalized, which whilst it is so common, it isn't normal to be leaking when you are coughing or sneezing or laughing or jumping. But I guess my big message is that it is treatable. So the biggest thing is, again, go and see a physio because you might have a lot of weakness or low muscle tone causing incontinence. You might have prolapse from a history of straining with your bowels for many, many years. You might be super, super high tone in pelvic floor and you can't let it go, can't relax. So by doing things like pelvic floor muscle training or pelvic floor exercises, that might make you worse. So there really is no one size fits all. You've really got to see a physio, figure out where you're at. Do you have a high tone pelvic floor? Is it low tone? Do you have prolapse? Do you have overactive bladder symptoms? You know, once we can figure out the root cause, it's so much easier to treat.
What's that appointment like? I feel like it's quite invasive. By hearing you say, do you have, overactive or low active? Like, is this like a full gynecology kind of session?
It is.
Because that also makes women nervous as well.
Totally.
Like for me, going for a pap smear, I'm not running to my GP.
No, it's not the funnest appointment to go to, but I can almost promise everyone it's so worth it and you do get so much out of it. I think the biggest thing is the first appointment takes a whole hour, and the first half an hour to even first 40 minutes, we're just talking. So we want to know, what's your bladder habits? How often are you doing your wee? How often are you doing your poo? Are you straining? Do you have incomplete bowel bladder emptying? Do you have pain with intercourse? We want to know all your background history. Yeah. And that kind of tells us what we're probably going to find with the practical exam. And so the gold standard assessment is an internal vaginal examination, which no one wants to have that. And it's quite intimate. It's very obviously personal. And that's why, this is why I love this space, because we really have tried to create an environment or a clinic that is welcoming. It's not so clinical. We explain every single step that we're going to do. You might go and get a pap smear and you're told to get on the bed, undress, and and off you go. And you're not told anything. You don't know what's happening, what things are going inside, what they're doing. Whereas the difference is with pelvic floor physios, we're explaining every single thing that we're doing. We're telling you what you will do before you're even on the bed.
I love that.
Yeah. And if we can pick up pretty quickly, someone's very uncomfortable and we will stop straight away. Everything is done with consent and it is optional. So even if you're not comfortable having the internal exam, we can still do as much as we possibly can without that. And you can still get a pretty good understanding as to what you might be finding and tailor a program to just doing a hands-off a treatment approach, Yeah. So it's definitely optional. It's gold standard and tells us everything we need to know, but it is optional.
Okay, that's good to know. Well, what's something that women can start doing today that could change their pelvic floor health?
I guess it's just
Is it those exercises you do on your Instagram?
Just see if you can
love those
it.
posts. Yeah. You're like, and hold. You have like so many views on those videos and comments. And it's like that reminder and hold. Wait, is that what you're saying?
Yeah. And squeeze and release. But you know what? Like
I need that reminder just like in the car and like put those reminders on my phone. How many times a day are we meant to be doing this?
Look, the answer is so variable. You know, like if you look just looking at strengthening.
Having lots of kids, lots of pregnancies, given birth a lot.
Yeah. Look, if you can do it once a day of the week, so every day of the week, bar maybe one day for rest, it's a great place to start.
Okay.
But I'm really cautious with saying and prescribing that without doing anyone's assessment. So all I would say as my big piece of advice would be just try and squeeze pelvic floor. Can you feel it contract?
Yeah.
Can you feel it lifting up like you're holding in wind and wee?
And what if you can't?
And what if you can't? Go and see a physio. Like see where you're at, you know. Try and release it. Can you feel it actually dropping down and getting softer down there, or is it just sort of staying on? Or maybe have a look, get a handheld mirror, have it down there and look at the actual vagina, pulling in, letting go.
Yeah.
If nothing is moving, you might be either really low tone or really high tone. So it's either not strong enough and can't contract or it's just too tight. It's just on the whole time.
Yeah.
So get a handheld mirror, even do your own single finger insertion. Put your finger inside, obviously clean it first.
Yeah.
And see if you can feel any sort of compression around that finger or relaxation. Just see if you can feel anything. It's a great place to start if you're a bit of a beginner and just want to know kind of where you're at. The biggest thing is just learning about pelvic floor and being aware of how to turn it on and how to turn it off.
What are your thoughts on, there's so many devices now out there. Like I've seen them and they're tempting, like different lasers and things. What are your thoughts on those?
It depends what it is. Some of them are backed by good quality research. So some of them that are purely for strengthening, where you sort of like have to squeeze the device, like go and play a little game. They're great because it might give you some motivation. And the hardest thing is, which is the reason why I do my online exercises, because most of us forget to do our exercises. So if you're going to buy a device that will make you do it, go for it. Obviously check with the physio first. Some of the ones that are more rejuvenation down there and more for aesthetic purposes, the long-term research isn't as backed up as it is, as we would like it to be. So you've really got to speak to a good women's health GP, gynecologist, and then physio as well.
Sarah, what are some common mistakes that women make leading up to giving birth in the gym?
First thing is they're not seeing physio, so they're not knowing what they're doing properly. And
everyone needs to see a physio after listening to this.
That'll be the key message. I think the biggest thing is two things is probably straining too much, so not breathing properly. They might be holding their breath during a lift, which can put downward pressure through pelvic floor, which can predispose you for things like prolapse and hemorrhoids.
Yeah, I actually learnt this on your retreat. So I thought that was I found it quite challenging because it was like the first time doing an exercise, like we were doing Pilates, but you're focusing on your pelvic floor. So I found it different kind of experience because usually you're just thinking of the exercise.
Yes. And it's really hard to coordinate that pelvic floor with the movement. You know?
But it's really important.
Yes, very important because you have increased laxity in pelvic floor when you're pregnant. So you had a lot of downward pressure anyway.
Yeah.
So if you're already starting with a weak pelvic floor, then you're going to add an extra load by being pregnant. You have a new organ, so your placenta grows, and you really need to have extra strength to combat that extra weight.
Yeah.
So that's the first thing. And the second thing is not doing enough or being too conservative. We have so much research now that doing exercise in pregnancy has so many benefits and it's actually potentially more detrimental for you to not be training as if you were training in pregnancy. So there's such a big emphasis now on actually doing what you were doing previously and not being so afraid of lifting weights or doing Pilates or doing whatever you want, provided you have clearance from your obstetric care providers. You know?
Is there a stage to wait at the beginning when you first find out you're pregnant or not really?
No.
I think women just get worried, right?
Yes. And you know what? First trimester, you often can have a lot of nausea. You're so tired. You are sleeping a lot. So you might not want to do as much as you were doing previously, which is so normal. And even doing some light movement, going for light walks when you feel up to it, you know, doing some light stretching, just something where you're moving your body within reason as you can. Everyone's so different. But if you can do the exercise, then it is so, so highly encouraged.
Yeah, great. So Sarah, in your clinic, what is one of the most common things that you see?
We have a really heavy pre and postnatal clientele. But I think the biggest thing we see a lot of lately is pelvic pain. So pain with intercourse, and a lot of our girls coming in are a little bit younger, so they're more early 20s and they're having a history of endometriosis, or maybe it's undiagnosed.
Okay.
Maybe their GP has suspected it, and maybe they've had trouble inserting tampons. And the biggest thing is pain with intercourse. But, you know, we see a lot of perimenopausal women too who are having, again, pelvic pain with intercourse from vaginal atrophy, or that low hormone drop that you get around perimenopause. So it can make the tissues quite porous and quite thin and more irritable, and you know, prone to that irritation.
Do you
redness.
guys know a bit about like libido with people and women who, you know, your hormones go up and down?
Yeah.
And you guys can guide people with that?
We can. It's definitely a multi-factorial approach. So it's not just to see a physio. It's seeing a really good women's health GP and good gynecologist too to help you navigate that time. But there are 3 times in life where your hormones have a massive fluctuation. So that's during pregnancy, postpartum, and then going through menopause as well.
Okay.
Especially postpartum, you have a huge drop in estrogen, progesterone, literally hours post-birth.
Really?
And then you have prolactin that increases, and even more if you are breastfeeding. So all of that suppresses libido quite a lot.
Yeah.
And if we think about postpartum, you've got fatigue, those endorphins kind of go to your baby, really. So that's the sole focus, and you might be you will be with your baby all the time. So it means less time for you and your partner perhaps. And there are so many factors that come into low libido, but the big hormone drop that plummets postnatally is a huge factor. And then again, slowly declines as we enter that menopausal part of our life too.
Yeah. Okay. So that's good to know that you guys even have that as a topic of discussion in your clinic, because I don't think women even really think to speak to anyone about it. They kind of just go through life like it's high, it's low, whatever.
And you would be amazed at, I would probably say almost every single client that I see postnatally, when we get to the postpartum intimacy chat, none of them want to have sex.
Yeah.
You know what I mean? Like,
first
of all, if you've given birth vaginally, especially, and this is there and you're still recovering.
Yeah.
So it's
so cute.
Hello.
So cute.
Join the party. Yeah, none of them want to have.
I don't think anyone would. I don't know. Everyone's different, but I just had a baby.
Yes.
Leave me alone.
And the thing is, I feel grateful because I can hear these women also agreeing with me, because I'm postpartum too, you know, and that's the furthest thing from my mind right now. But it's one of those things that no one talks about it in the community, and it makes you feel so alone if your libido has dropped, and you just want to know that other women are going through the same thing, and it is a really normal part of having a baby.
Yeah, I definitely see that. I think it's more when your little ones, like my youngest is 4. So later on, it's like when you feel like, do I have a low libido or am I just exhausted?
Yes, exactly.
It's finding out
the
difference.
What came first, chicken or the egg? Is it the low libido from hormone drop causing you to not want it? Or is it the fatigue causing a low libido? It could be both of them.
Yeah.
You know, and often the drop in fatigue, and also a drop in like your nutrients, what your vitamin D, your calcium, all those things, your iron levels, those come into play so much as well postnatally. So if you are in a nutrient deficiency, which you probably will be postnatally with being in that postpartum depletion stage, then that also affects libido. So I've learned from my sister quite a lot being a dietitian in this space.
Yeah, that's a great pair of you two together.
Yeah, I'm now taking a lot more supplements and vitamins to actually help me in that postpartum depletion phase. I'm not experiencing it as much as I was with Sophia, my firstborn.
Yeah. Sarah, I wanted to ask you, do you think, what is it called? When they put, it's to help your digestion go out.
Like laxatives?
No, but they put the pipe.
Oh,
what is it called?
Like not a colonoscopy.
Yeah.
Yeah.
Are they good? Because we were talking about leakage for one, but we're also talking about bowel movement as well. Do you think that's good or bad? Because I hear such different sides. We've got a little guest, guys.
Hello. Are you going back to sleep?
Because I've heard such different opinions on this.
I think you're talking about colonics.
Yes.
Yes, not colonoscopies.
Yeah, no. Colonics. Yes.
So that's a great question. And the thing is, the bowels are part of the enteric nervous system, which means they work on kind of a hamster wheel, right? So you want it to work in where's my brain working? You want it to kind of be on a routine, right? So the thing is, if you're having a colonic and you're physically flushing out all the contents in your colon, then it almost like interrupts that hamster wheel where it doesn't necessarily fix the problem. Yeah, it clears you out, but you want your bowels to be working normally by themselves, not having to rely on supplements or laxatives or colonics to do that. And I've had so many clients have repeat colonics and their bowels are just all over the show.
Yeah.
It's great for a week or so and they get blocked up again. It's not fixing the problem.
It's not a long-term solution.
No. So look, whilst they have a place, sometimes it's definitely not my first choice of treatment for anyone with chronic bowel issues.
Yeah, I've heard such mixed reviews, so that's really good to hear your opinion on that. With someone who is in that situation, what is something that you could recommend?
So seeing a women's health dietitian, that's the first thing, and a women's health physio. Those two.
Physios help with that too?
Yeah. So we don't know.
See, I don't know why people I don't think would think to go to a physio for something like that.
No. So the reason why physio can help is because it could be an outlet obstruction. So your pelvic floor could be wrapping around your rectum so tight and it can't let go when you empty your bowel. So it could be an outlet obstruction by the muscles.
Wow.
Yeah. Or it could be you've had.
But how do you figure that? Is that like a deep tissue like filled down on the stomach?
That's the internal vaginal exam. So we can actually feel the muscles. Yeah. So there's a muscle called puborectalis that wraps around the rectum. And often we can feel it straight away. If it's rock hard and you can't let it go, you're probably going to have constipation or troubles emptying your bowels.
How often is like a normal kind of how many times people should go a day?
Yep. So it's normal to empty your bowels either once every 3 days or 3 times a day. However, that's a really big range, right?
They're two really different things.
Yes. But the key is consistency. If you're someone who's emptying your bowels twice a day, every day, you have zero issues, you're not straining, it's a type 3 or 4 in the Bristol stool chart, then perfect. If you're someone who's emptying your bowels once a day, then not for 3 days and then 4 times a day and really irregular, that's not normal.
Okay.
So it's a really big range, but as long as you're consistent, that's still within normal limits.
Okay. That's good to know. Okay, Sarah, so you've just had a baby. So can you share with us any tips from being a physio yourself and you just had a baby that you could give to anyone listening that's, about to have a baby also?
Yeah. I think find your support network. Find, obviously, women's health physio to have a chat.
Find yourself a physio.
And learn as much as you can about recovery. I think nutrition is a really big factor in recovery, whether you've had a vaginal delivery, stitches, forceps, cesarean, elective or emergency. That's a really big key is optimizing your nutrition, and also fluid intake is a really important factor. Whether you're breastfeeding, whether you're literally going through postpartum in summer, you need that fluid for your bowels too. If you're dehydrated, you get constipated. That's not going to be fun if you've had a vaginal delivery. Movement's really important. So obviously, the advice would be to start really slow, start with some small walks, maybe by week 2 or 3, if you feel up to it. The key is if you feel up to it. And stay on the flat, just go outside, get some fresh air, come back and see how you feel. And if that felt fine, you had no vaginal heaviness after that walk, you had zero pain, then great, do that again the next day. And then maybe the next week up the ante and up the distance you're walking. Movement will really speed up recovery, and we actually are really big advocates now of early movement postnatally too, which is why we see clients at 3 weeks postpartum just to get you back.
Movement as in
exercise, walking, doing some
Because I thought it was 6 weeks of no exercise.
It was. So a lot of it's changed over the past 5 years with new research coming out. And the thing is, our question is, if you go in for a lumbar spine surgery, so you've discectomy, for example, you are up moving day 1 post-op. You are doing pelvic floor exercises, core exercises, day dot. The question is, why are we letting women who have had babies rest and decondition even more for 6 weeks after having a baby? It makes no sense. The faster we can get you moving within reason, the better your recovery is going to be any day of the week. And that's a fact. And we can back that up by a lot of really good quality studies. And the same thing too is with ab separation. So we know we have this thing called the remodeling phase in the first 3 months postnatally. So it's the best time for you to actually improve tension down the midline of your core and reduce separation. that's the best time to actually be working on that, whether it means doing core exercises. Yeah, within the first few weeks.
So not like sit-ups. Or like sit-ups.
We actually want to be doing crunches early.
Oh my gosh. Why am I just hearing this now?
You can be doing it. And we actually encourage, I know it's very new now. We've had a few. Because
my youngest is 4, so that's like.
It's changed since then.
That's quite some time ago. But I just remembered 6 weeks.
Yeah.
And also like online, the criticism. When you're working out, when you have a newborn, you just get, you know, the comments and everything is like, you're not meant to be working out, focus on the baby. You're promoting a bad, you know, bounce back kind of culture.
Yeah.
But you're saying from a physio, you guys can hear it from a professional expert physio, that it's actually better for us.
100%. It's my one thing. If anyone asks me for advice around pregnancy and post-pregnancy, that's it. It could be anything. Is exercise.
Oh, wow.
Go to Pilates, go and do your strength training, go and do what you enjoy doing during pregnancy and during postpartum, within reason, with guidance of health professionals, you know, if you can.
Oh my gosh. Okay. Well, I kind of liked the 6 weeks of no exercise. I'm not going to lie. I was like, I cannot lift anything. Cannot do anything.
So fun. Embrace it. So I kind of
liked that, but that's good to know because I did, my ab separation went away, but I remember when I had the kids and you can put like all the fingers and then it goes, it's very amazing, the woman's body. Okay, well, Sarah, I want to finish up because we're running low for time, but I actually saw a post on your page and I feel like it got a lot of heat. I'm trying to remember. It was about.
Many do.
You're like, which one? It was about picking your cesarean, was it?
Yeah, there was a lot about my elective cesarean.
Yes. Okay. Because I saw that and I actually wanted to ask you about it.
So it was, someone had commented about, they felt so misled that as a women's health physio, I chose an elective cesarean.
Yeah. So why? Talk me through that. Because that's a you know, valid comment right there.
Yeah. And the thing is, like, why are we not allowed to choose what we want? There's so much mum shaming and there's so much judgment around what kind of birth we want. And it comes down to my personal preference. And it's so funny because I had so many women DM me saying, thank you for talking about the fact that, you know, cesareans don't always come, they're not the easy way out. They're a major surgery.
Yeah. And longer recovery usually?
It can be, yeah. And people don't realize that. And that comes down to education.
Yeah.
You know, like why I wouldn't have had a cesarean if I didn't think it was safe and it wasn't the best thing for my body.
So, Sarah, why did you choose a cesarean?
So, again, I had my own personal preference for that. Like you know, we are very biased as pelvic floor physios and we see a lot. We see a lot of trauma. We see a lot of things go
Has
wrong.
That scared you away from having a natural birth?
Do you know, in my pregnancy with Sophia, I was going back and forth. I'm going to have a vaginal delivery. No, every day I was changing because for a vaginal delivery, I wasn't scared at all because I'm a women's health physio.
Yeah.
Like, if anyone can help rehab myself, it's me or my team, you know? So I wasn't scared of that. But a cesarean, I like to have my life planned out. And this sounds terrible. Like I like to be booked in and I had zero desire to go into labor. I know so many people who, and this is probably a bit controversial and so be it, it's just my opinion, but I didn't have that desire to go into labor. I had the most beautiful cesarean experiences and I picked my obstetrician for a reason. I've seen his results and I was so happy with his results and I just wanted to have a date booked in, have it all planned out and I just wanted a cesarean. You know, that's just what I wanted. And I don't think any woman who is choosing a type of birth should be judged for that. And I've had so many DMs of women saying, thank you for talking about this because whoever they were, got so much judgment and so much hate for having cesarean.
It's similar to breastfeeding and not breastfeeding. That decision, you get a lot of
there's so much mum shaming.
Opinions from others. And I think everyone really just needs to focus on themselves. But with yours, I think everyone was so intrigued because you are a physio. So maybe people were thinking, did you see something go wrong? Is that why you opt out?
But of course I see things that go wrong every day, you know. Yeah. But I also see incredible births. You know, I have treated women who have had incredibly difficult upbringings. We've had a history of chronic endo and a lot of pelvic pain. And super high toned pelvic floor and have amazing vaginal deliveries. Like I know it can be done, but I just didn't want to have one.
So for you were just like, I want to date, I want to be organized and in and out.
Yeah. And it was
love that.
An incredible experience. And I pulled her out, did the maternal assist. I pulled both the girls out. And I love that. Like my obstetrician had my hands down. He said, "That's your uterus." And I was like so intrigued.
Oh my God.
A bit weird, but I just loved it.
And then just pulled out the baby.
Yep. Wow. So they scrub you in, your hands go up and they scrub your hands in.
Wow. My sisters did that for one of my births.
Yeah.
Yeah.
Wait, for one of your births?
One of my pregnancies.
Oh.
Yeah.
They were part of it.
Yeah.
Oh my gosh.
I had my husband out of the room.
Oh
and
my
sisters in.
And they scrubbed in.
Yeah.
And they helped to.
Yeah.
Oh my gosh.
Well,
it's
Sarah,
so
thank you so much for coming in. Oh,
good timing.
She's done too. Good timing. We could chat so much more because I absolutely love your approach on your life. You're not going to feel, persuade or, someone's judgment's not going to change your mind. I absolutely love that. Your body, your life. And I think that's such an amazing approach and perspective on the situation. So thank you so much for educating us on pelvic floor. I feel like everyone listening, has walked away learning something, and also just your attitude of your body, your way. And I absolutely love that. So thank you so much for coming on.
Thank you for having both of us.
I love that. She's so cute.
That was good timing, sis.